Hi, it's Dr. Jonathan Yousef, Networking for Your Optimal Health. Today I'm going to talk about gastrointestinal health. Why am I talking about this? Because many of my patients with autoimmune disease, mental health issues, immune deficiencies, musculoskeletal issues with inflammation are all asking me, is the gut part of what's going on with me? And yes, the answer is we believe there is something called leaky gut, which can contribute to chronic disease. Where is this important? We think that our nutrients that we take in are the building blocks for most of our neurotransmitters in the brain, but also perhaps the focus or the immunity of our body is primarily in the gastrointestinal tract. Hence is why we started thinking about things like probiotics, a detoxifier, and some peptides. So let's get right into it. We think that foods, medicine, chemicals, bacteria, fungus go through the gastrointestinal tract. We take out the best of it, right? The vitamins, the amino acids, the nutrients. But what we don't want is the toxins, right? And then the oxidants and things that damage that gut. But not just damage that gut, but leak into it. That's why they call it leaky gut, because it's now going into the bloodstream and causing much more problems. So let's focus on two items that help detoxify us. So once that gets into the bloodstream, our liver and our kidneys help to detoxify a little bit. Where does this come in handy? Is let's find out what foods and what type of chemicals or bacteria are in your gut. You can check those out and see if we can find the root cause, but we can also stop some of those things that we know are causing these leaky gut. What we want to do is also clear out the liver and the kidneys. I love a product called Advoclear. It's a combination of milk thistle and acetylcysteine, plus some other methylated vitamins. My favorite type of detoxifier. It's only a 21-day, but you can use it actually every day for those who have more chronic problems. In the second benefit or the second option is to add probiotics. I like orthomolecular product called Orthobiotic. I love taking it daily. I recommend at least 3 months of both the Advoclear and the probiotic. That way you can see the maximum results. But the third option, which could be for those who are looking for an outside of the box thinking or maybe new age treatments, a little bit more functional medicine, non-FDA approved option are some peptides, BPC 157 plus the KPV. The recommendation for these two has been in oral form. We recommend a daily form so that it can help heal the gut. And if you want to look online and research it for yourself, we'd love to talk to you about it and offer some options.